Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day we are interviewing consequential leaders and innovators in the battle against the coronavirus. California has just implemented mandatory masks outside of the home. Controversial for some, but deemed essential by others if the spread of coronavirus is going to be mitigated and stopped. Vulnerable communities and elder care facilities, among some communities of color, among the homeless, are still targets for a virus that continues to hunt in our society. Another community that has been hit hard are veterans, who have sought support and treatment from the Veterans Administration and for whom the VA stockpiled treatments of hydroxychloroquine, which has mostly been invalidated as an effective treatment for COVID-19. One of those who has been pushing hard for mask standards and for greater public health awareness and investment, and who has been raising questions about the conditions and treatment that veterans have received, is Congressman Mark Takano of California's 41st District. Representative Takano is chairman of the House Veterans Affairs Committee, and he's also a member of the Subcommittee on Workforce Protections in the House Education and Labor Committee. He is co-chair of the LGBT Equality Caucus and is the first out LGBT member of color in the U.S. House of Representatives. And he's also working on behalf of veterans needing work. He is also co-chair of the Congressional Work for Warriors Caucus and has been unrelenting in pushing that legislation. Thanks so much for joining us, Mr. Chairman. Representative Takano, thank you. Let's start first with California's mask requirements, which are setting a standard for the nation that a lot of the other nations are not following. But give us your thoughts on how that's going over in your district.
Well, actually, the norms, the social norms in my district, in my area, I think are pretty compliant with mask wearing. Riverside County's health officer actually put in place an order, which was later rescinded by the Board of Supervisors. And the elected county sheriff did say several weeks ago to the Board of Supervisors, if you extend those health orders, including mask wearing, I won't enforce it. I, the county sheriff, know the Constitution, and I have a right as county sheriff to decide which ordinances that I will enforce. Orange County's sheriff did something similar. So we've seen mixed signals go out to the public, but the public itself in our area and to the east of me, in Dr. Ruiz's district, made up of a lot of retired folk. The actual social norms are that people are wearing masks. You go to the coasts, not so much. I'm hearing from people who go to Huntington Beach or the beach communities, mask wearing and social distancing, especially among the young, is simply not a norm. And I think the governor is trying to rein back what he opened up. And I think he's realizing the infection rates are going up or they're staying constant. As we test more people, that infection rate is staying constant. It's not clear that the rate is increasing, but certainly I think he's very concerned, and I don't think he really wanted to open up as fast as he did. But we do have elements within the society that really wanted to open up more aggressively. So, Steve, my feelings are that it's unfortunate that mask wearing has become so polarized. It shouldn't be. And it's, I think, essential to have mask wearing as a norm if we are going to allow for some more commercial opening up, more commerce to opening up. I think it's clear that the virus is not as lethal and deadly as the great influenza of 1918, but it's certainly way more deadly than the ordinary flu. And the mixed messaging of political leaders has led to this bizarre moment where scientifically valid and very effective means of controlling infections through mask wearing has become a polarized subject.
Well, as you looked at what happened over the weekend with the rally by the President of the United States launching his campaign in Tulsa, we saw a smaller crowd, but still a large crowd of mostly unmasked people, and some people were burning their masks. They were, I should be, just truth in advertising, they were giving free masks out at the Tulsa rally. But there's just no doubt that this has become, as you just said, a polarized issue. Do you have any optimism at all that leadership in both parties can resolve this rift, if you will, around a major public health issue?
There is some optimism. I think, unfortunately, it may take more people dying, ICU units being overloaded again. And, you know, as with the AIDS epidemic, which initially was mostly confined to the LGBT community, specifically gay men and intravenous drug users, as people began to know people personally who died, I think that's when uh, the idea that it wasn't going to affect you personally changed. Look, Steve, I think it's important to tell stories about Hawaii. Hawaii is the one state in our nation where they have very few infections, and where I just spoke to a friend who has a condo in Hawaii, in Maui, and he was going to go to Hawaii and maybe endure the 14-day quarantine, which was required of everybody who lands in Hawaii. You have to go to a quarantine. You self-quarantine in your residence. You can't even take out the garbage, potentially. You're facing a $5,000 fine. You fill out a questionnaire every day, and you have to report to the health officials. And you fly from Maui to Honolulu. You've got a quarantine in Honolulu, and then vice versa to return. I mean, they're taking it very seriously in Hawaii. And we have one American state where I believe, the measures are being taken very seriously. And, it's unfortunate that the rest of the nation, if we try to impose that level of rigorousness, we would meet with a significant amount of rebellion. And talking to John Barry, who wrote The Great Influenza, the book about the 1918 pandemic, it wasn't that much easier then to impose restrictions on people. There were actually public officials who were threatened at gunpoint.
Wow.
And we certainly don't have the civic education and understanding to understand that measures, very rigorous measures taken during a pandemic, are certainly constitutional. But people have gotten in their heads that their constitutional rights are being violated. Many people think this is a Democratic conspiracy or plot to oust the president. And I do lay a lot of responsibility on President Trump's shoulders for pointing fingers elsewhere. Now, if I could, I want to shift toward other hopeful signs. A competent addressing of threats to veterans at the VA. We have something in the VA called CLCs, or community living centers. Otherwise, ordinary folks would know them as long-term care facilities.
And those are primary hunting grounds for this virus. That's.
So here's the news.
Yeah.
The VA operates its own CLCs. They do not operate the state veterans' homes. They fund the veterans at those homes, but they do not actually run those homes. The states do that in various ways. The actual homes that the VA runs have had very low infections and very low death rates. And the patients there, the veterans who are there, have far more complicated medical conditions, far more vulnerable than the seniors who are residents at private homes.
So what is the secret of success there?
They tested every resident. They tested every employee. They locked down those facilities early. In fact, they got a boatload of complaints from family members who couldn't visit their veteran relatives, and they have continued to that vigilance. And VA, because it has an older population, it has an expertise in geriatrics. In the state of Virginia, they're actually offering, they're actually in an agreement with the state of Virginia to provide that consultation and expertise to all the private nursing homes. And in fact, VA has, and under its fourth mission, a responsibility to be the backstop when the regular healthcare system is breaking down. And part of my frustration with this administration is a lack of a national testing strategy, saying that the states are responsible for getting PPE out, and just the abnegation of any kind of leadership and responsibility.
Well, how did it hit you, Mark, when the president said at his rally that he wanted to slow testing down?
Well, that's ridiculous because it contravenes the care and concern that he had. Well, it's not care, but the concern he had over liability, that people could get coronavirus at his rallies. They had to sign a release of liability statement. And look, I don't want to lose the lesson that the VA has to teach. At least a third of all the deaths in this country of coronavirus have occurred in places like nursing homes. Mm-hmm. I want to take the lessons we learned at the VA and apply it to the rest of the nation. The president should say, let's prioritize testing and let's make sure that every nursing home in America has enough testing so that every employee and every resident gets tested. But that leadership is missing. I mean, that's a very low-hanging fruit that we can, beyond the controversy over face masks, who could argue with let's test everyone who is a resident in a nursing home, every veteran that is in a state veterans home. And then I think we need to think about that same standard to other congregate living situations, such as our prisons and jails. The jails and prisons in rural America are real danger zones, and the prison guards, the people, the whole situation, our federal prisons, that should be an emphasis. We know a lot more about what's happening with infections, and we can do more to control infections. But then we have to build, I think, a societal consensus about face mask wearing. We have to disabuse people who think that it doesn't matter and that this virus is not a threat. And finally, we have to pass, further relief through the HEROES Act. The HEROES Act is stymied. The unemployment benefits are going to run out in July. We have to extend those unemployment benefits. We're not going to. This opening up has not resulted in a miraculous recovery of the economy. The social dislocations, the unjust ways in which our nation was already organized going into this pandemic has been revealed, and it's going to be made worse if we allow people to continue to suffer. We have to take care of our frontline essential workers who must work, who do not have the option of working at home. We need to pay them bonus pay. And we need to get the extension of another round of benefits out to people. It's complete madness. Yeah. The dithering, the delay, and the idea that we're going to incentivize all these people to go back to work by taking away their unemployment benefits. Right. This is a cruel and inhumane vision.
Well, Congressman Takano, I know we're out of time, but I just want to say thank you, and I will publicly invite you, if you'd like, there are many topics you raised, but to write that op-ed, 1,000 words on Veterans Administration CLCs and lessons learned. I think that sounds like a very valuable set of insights. Next time we'll talk about the Supreme Court decision, about the George Floyd protests, so much. But thank you for joining us and giving us your insights into what's going well, much more than I had thought, and those things that aren't. So really appreciate you joining us.
Thank you very much.
And I want to thank all of you for joining me today. We're going to see you tomorrow. I'm Steve Clemons. Be well.